enforcement when responding to cases involving primarily the elderly living in ALFs, nursing homes, or even in a hospital situation. So in 2023, Polk County law enforcement responded to a battery of a person over 65 involving 2 roommates in a long-term care facility. Suspect and victim were both over the age of 65, and the victim actually declined to press charges, but the battery is classified as a felony, requiring pretrial detention under Florida's elder abuse statute. And the suspect was arrested and actually ended up dying in custody. So, this law, this is, sometimes the legislature reacts to situations and they don't know that they need to create a law or build a law until something unfortunately happens in real life. This is a good example of that. So this law gives law enforcement some discretion at the scene now in these kinds of situations. A couple more, House Bill 1299. This was actually DOH's, Department of Health's agency package bill. There's too much really to go into in detail today. It was a very long bill. But bottom line, the bill revises laws related to Florida's healthcare workforce, healthcare services, healthcare practitioner licensure, and regulation related to DOH, a lot of very technical and nuanced stuff. One item to point out, it does postpone from 2025 until 2027 the scheduled repeal of the statutory definition of messenger ribonucleic acid vaccine. I guess you guys haven't heard that term in a little while. Messenger RNA, and reenacts related provisions on discrimination and mask or vaccination mandates to preserve that definition. And House Bill 1353, this legislation by Representative Franklin actually removes geographic restrictions to allow a home health agency administrator to manage up to 5 agencies that have the same controlling interest regardless of location. 1427 by Representative Griffiths, that bill revised regulatory oversight of pre-licensure nursing education programs. That bill was a reaction to some things that were going on with so-called fly-by-night nursing education programs, and so it gives the governments more tools around policing that situation where nurses were not passing their exams. Senate Bill 1490, another one by our friend Senator Harrell, requires Department of Health to transfer the Children's Medical Services Managed Care Plan contracts, which serve children and youth with special healthcare needs, over to the Agency for Healthcare Administration, which has all the managed care contracts for the rest of the Medicaid program. So it just sort of makes sense that AHCA also have management of this contract. The bill also requires AHCA to develop a plan to redesign the Medicaid model waiver to include a new tiered service array for children and youth with special healthcare needs who receive private duty nursing services. And then finally, Senate Bill 1768. This bill authorizes physicians to perform stem cell therapies for orthopedics, wound care, or pain management, which are not approved by the US FDA, and establishes standards for physicians who perform authorized stem cell therapies. It also prohibits treatment or research using human cells or tissues derived from a fetus or an embryo after an abortion, and the sale, manufacture, or distribution of computer products created using human cells, tissues, or cellular or tissue-based products. So a quick look at the budget. As we mentioned previously,